And now let's jump to the management of case COPD. First of all, manage what? Shortness of breath, okay? Decrease frequency and severity to exacerbation. The first step you're gonna do what? Reducing exposure to noxious particles, I mean smoking cessation and gases, okay? The second one we have what? Bronchodilator. Bronchodilator, I have short-acting bronchodilator and long-acting, okay? Short-acting bronchodilator for mild disease or anticholinergic ipratropium can be used, okay? This is regarding short-acting. Long-acting bronchodilator for moderate to severe disease, okay? This is regarding short and long. In the other hand, we have the third one, oral bronchodilator therapy, such as theophylline preparation concern in a patient who can't use inhaler device efficiently, okay? But it's limited due to side effects. The third one, as I said, the first one is reducing exposure. The second one is bronchodilator. The third one we have what? Combined inhaled glucocorticoids and bronchodilator. Okay, LABA, long-acting beta agonist. Okay, I mean improve lung function, decrease severity and frequency of exacerbation, and improve quality of life also. Okay, product like what? Bambuterol. Okay, LABA, inhaled glucocorticoids, can be used frequently given with what? With LAMA, L-A-M-A, I mean long-acting muscarinic antagonist, okay? Should be used with caution is a patient with heart disease and history of what? Urinary retention, okay? This is regarding the third one step. The fourth step, we have what? Oral glucocorticoids, okay? Useful during what? During exacerbation, okay? But maintenance therapy contribute to what? Osteoporosis and impaired skeletal muscle functioning. And the fifth one, we have what? We have pulmonary rehabilitation. The sixth one, we have oxygen therapy. The seventh, we have what? Surgical intervention, bulectomy, considered when large bullae compressed surrounding normal tissue, okay? Patient with upper lobe emphysema or emphysema is what? Preserved gas transfer and no evidence of pulmonary hyperinflation. So what we're gonna do, maybe benefit from lung volume reduction surgery, LVRS, okay, in which peripheral emphysematous lung tissue is what? Resected with the aim of what? Decrease hyperinflation and what? Decreasing the work of breathing, okay? So both bulectomy and LVRS performed by what? Thoracoscopically to what? Minimizing morbidity. And the eighth one of steps, we have what? Palliative care. Morphine preparation for palliation of SOB, shortness of breath in advanced cases, okay, in advanced disease, and benzodiazepine low dose in decrease and anxiety, okay? So they are all about what? Management of what? COPD, okay? And what about prognosis? Prognosis related to age of the patient and directly related to the what? Post bronchodilator FEV1 forced expiratory volume, okay? So we have body score, BODE. Use it, assist in predicting what? Death for respiratory or other cause. I mean, B standing for body mass index, BMI, okay? O for degree of the airflow obstruction. D standing for what? For measurement of dyspnea, okay? E for what? Exercise, what? Exercise capacity. And now let's jump to the what? To the acute exacerbation of COPD, characterized by what? An increase in symptoms, okay, and deterioration in lung function and health states, okay, when disease what? Progress, usually triggered by bacteria and virus, okay, may accompanied by what? Development of what? Respiratory failure and or what? Fluid retention, okay. And at that time, may patient manage at home with what? With use of increased bronchodilator therapy with a short course of what? Oral glucocorticoids, okay, if appropriate antibiotics also. But sinus and peripheral edema or an alternation of unconsciousness of the patient should what? Should refer to hospital. So the first step what we're gonna do what is oxygen therapy. High concentration may cause what? Respiratory depression and worsening acidosis. So controlling oxygen at 24% or 28% should be used with the aim of what? Maintain PaO2 or more than 60, okay, or SaO2 more than 90 without what? Without worsening acidosis. And the second step, we have what? We have bronchodilators, okay? So nebulized short-acting beta-2 agonist plus what? Plus anticholinergic agent is performed. For example, salbutamol plus what? Ipratropium, okay, should be administered. So this is regarding bronchodilator. And the third one, the third step, we have what? Glucocorticoids. Oral prednisolone is what? Reduce symptoms and improve lung function, okay? So those is what is, those of the prednisolone start with 30 milligram of prednisolone for 10 days, okay? So prophylaxis for osteoporosis should be considered, okay? And the fourth step, we have what? Antibiotic therapy. Antibiotic therapy currently recommended for a patient in what? Reporting increase what? Sputum purulence, sputum volume, or shortness of breath, like what we call aminopenicillin and tetracycline or coamoxiclav, okay? The fifth step, we have what? Non-invasive ventilation is useful and is safe and effective in patients with what? With acute exacerbation COPD complicated by what? Mild to moderate respiratory acidosis, I mean pH below 7.35, okay? So considering a case of what? Respiratory failure also, and it's not useful in patient with what? Who can't protect their what? Airway. The sixth one, we have what? Additional therapy. I mean diuretics in a case of peripheral edema or respiratory stimulant like doxapram, okay? And they are all about acute exacerbation COPD management and about discharge clinically when clinically stable on their usual maintenance medication, okay? They are all about COPD. Hope you get a benefit from this video. Thanks for watching.